Yeah, good morning everyone. My name is Brian Rothkin. This morning I'm going to go ahead and give you a quick demonstration of how to properly set up an IV station in case your medic needs help down the range in any type of scenario where he is over cumbersome with a workload. This way you can guys go ahead and properly do this form and expedite everything. It only involves 3 steps. First you want to gather all your equipment, and then you're going to inspect your equipment, and then you're going to place it in appropriate areas. When you gather your equipment, you're going to want to gather constricting band, 2-3 sets of gloves, some alcohol swabs or wipes, needles, obviously, saline lock or an extension kit if you have it. We currently don't have any extension kits, but we are working on getting some. An inclusive dressing, a flush to go ahead and clean the lock itself, and any bandages. Also, you're going to want an absorbent pad underneath, maybe like it's called a chuck. It's a little blue pad. I'm sure you guys have seen them. So when you go ahead to inspect your equipment, you want to go ahead and thoroughly inspect every part of it, because medical equipment is very, very important. Any type of blood residue on this is no good, so you got to throw it away and get a new one. Any tears in the gloves, throw them away. Alcohol swabs, they have expiration dates, so you want to go ahead and make sure they're not past their expiration dates, which this one is not, because otherwise they will dry out. And needles, most importantly, this is the most crucial thing you should check for. These are very sterile. They cannot touch any type of surface. They are capped, and they have expiration dates as well. So if you were to unpackage this and place it on the absorbent pad and it falls on the floor, don't try to cover it up, throw it away, because you can risk someone's life at that point. Saline locks also have an expiration date. They are also sterile, so make sure that you check all the expiration dates. Occlusive dressings is just like a bandage. It's not too important. These don't have any expiration dates. Just make sure they're sealed. Flushes, expiration dates. So you want to go ahead and check on the actual syringe itself. It'll have a date, or it might become in a package. So you want to check those, and then some bandages, and obviously the chuck itself or the absorbent pad. Don't need it. It doesn't have an expiration, I should say. So when you go ahead and you place your equipment, you're going to want to place in the order that you use it. Personally, that's how I find it best, but get with your medic at that point, because he might have it different way. I like to place my constricting band first, and I'll place it on the chuck on the left side. So if this is the absorbent pad on the left side, because I'm right-handed. Then you want to go ahead and place my gloves, my alcohol swabs, place my needles, then go ahead and place my saline locks or extension kit. Once again, we don't have extension kits, but I'm working on getting those for you guys right now. Then you're going to go ahead and place your occlusive dressing, your syringe, and then your bandage. So once all this is in place, obviously it won't be as far because I have some extra stuff. You always want to grab extras. Extras are very important, because if you miss on an IV stick, you don't have to go running around for another one. So make sure you have more than one item. It's always a good thing to have, and any extra items your medic may require. If you guys have any questions of me of any sort, I'll be in the back of the room for the next few minutes.